Hi, this is Steffen Schmidt for Insider Iowa. Um, the healthcare reform debate is almost over. The Senate has a kind of, let's call it a director's cut, which is the leadership of the Senate has taken a previous bill, put it all together, cleaned it up, taken out some controversial things, added some things that they think improve it, and they're going to send that one now to the conference committee, which is the committee made up of House and Senate members. The House has already passed a bill that's significantly different, and then the House and Senate are going to try to reconcile or work out the differences between those. It looks as though there will be a health care reform bill. It'll be large. It'll be fairly complex and have a lot of things in it that some of which you may like or not like, some of which people think are real improvements in many aspects of health protection in the United States, and other people say there are other things in it that will make this very expensive and will, do something bad. The criticisms come from so many different directions that I know of almost no one who, can speak favorably for this legislation. It's been a brutal battle in Congress, public opinion, with interest groups, the Obama administration trying to basically address the two issues that we've talked about before, coverage for most Americans of some sort, and trying to contain the cost of it. We'll see how that all works out once the legislation is passed and begins to be implemented. I wanted to just make this comment. Once the president's signature is on that bill, and he has handed out the famous pens that the president always hands out, they kind of write a little mark, and then they give a pen away, and then they write another little mark, and they give the pens to the people who have, in fact, helped pass the legislation. Number one, when that happens, there won't be any Republicans there. This is one of the first times in American history, or in recent history, since the Civil War, that we have been so partisan that not a single Republican, in the Senate at least, will support this. There may be someone from the House, some Republican who has supported it, who will be there to receive one of those famous pens, but it's a very divided country. The other point I wanted to make was that once President Obama affixes his signature and it becomes law, none of us are going to want to talk about health care reform anymore for a long time, months, maybe years. It is so complex and so divisive. We are all going to collectively go, it's just a relief that that's over with, and other issues, of course, will then emerge as difficult challenges that we all have to work on. State and local governments have a lot of real serious financial problems with pension funds and other things. The war in Afghanistan is going to be challenging us and getting our attention. There may be unforeseen things. But I think that President Obama's public opinion polling numbers will go up after the health care reform legislation is done. And for a year, we will not even remember a year from now that there was this divisive debate. But by next November, anyone who tries to rekindle the health care debate issue for political purposes is going to be booed out of town. So happy holidays, Merry Christmas, happy Hanukkah, and other festivities. Healthcare reform is hopefully behind us, and some improvements will occur, and we will move on to other major issues. And right here, InsiderIowa.com, we will talk about them and share them with you, and hope that you will sign up and join us. We have a newsletter that will be going out about monthly with just some general and hopefully interesting material that you have requested. And of course, Insider Iowa remains free for you to use, and we're very pleased with it, and thank you for your support.